The last thing I want to leave everybody with is this concept, and we've sort of been talking around it already, and it's sort of referred to as health in all policies and in all things approach. And what that sort of means is that we want to make sure that the entire process of what we're doing, rather than little pieces, actually produces health for everyone. And that sort of includes making sure that we have a systems thinking approach. But it also sort of asks us to think of these questions of what are the essential services and the essential things that we do with health. So what are the core functions? Is it to obtain data and do development of policy based on that data? Is it also to make sure there's oversight? Is it to inform the public and mobilize people so that we get partnerships and we identify and solve actual health problems, whether they be communicable or non-communicable? And are we supposed to develop policies that support all those community efforts? And if the answer is yes to all of that, then we have to make sure that the entire system is built to do that. So we have to recognize that there's a very complex relationship with health, and that it is an interaction of certain risks and certain diseases, and that we look at what are the tools we want to use to make sure that we have health in all policies and health in all things and all components. So we have to sort of look at how are we going to set priorities? Do we set priorities to only address health that is impacting very few people, or do we look at what impacts the most people? How do we build in accountability? So is it that it's occurring between two or more diseases and they interact? Which one do we look at? What is the occurrence of them? What is the burden of this disease? If you looked at what I've said previously, that depression, mental health is the number one disease burden, then we should be putting tools, programs in place to, and this is globally, this is not just the US, to address depression, because it obviously impacts more people. The disease burden is longer and bigger and wider. So if we're going to come up with a health policy for health in all things, then every single component of our health delivery system, from public health to individual health to agencies, should be dealing with that component of mental health. It's not, and that's one of the reasons we have other issues, but it is something to think about, and it's a way to think about how do we build this into each component. We have to look at what are the syndromes of this. So are there other diseases that predispose you to other diseases? So if you have lots of communicable diseases, it predisposes you to having a short lifestyle and a life in itself. What else can we do to make sure that that doesn't happen? How can we reduce those risks? Are there a pattern of risk factors and symptoms that occur together? So like with HIV, we also know that TB happens. So how can we make sure that those two things are addressed versus just one or the other? We also have to look at the entire system and say, okay, here's the policy and the implementation we want to do. What are the bottlenecks in the system or in the community that are going to keep us from doing that? What's going to slow us? And then at the same time, look at what is our leverage point. So what is the point that we can look at and have better, more successful interventions? Is it more community involvement? Is it producing and developing and delivering health interventions in a different way? So for instance, if we want to make sure that people have lower risks of stroke, and we know that undiagnosed hypertension occurs, or we want more women to get mammograms because we know the sooner that we diagnose it, the better outcomes we have, then and we know that certain populations, African American populations, for example, go untreated and don't have enough preventive health, and there's also not enough doctors close to them that they may or may not trust, then one of the ways we would do is, what's a leverage point? Where do people go for information? Where do people go every once a month that could deliver these services? So some really innovative, cool things happened. We went to beauty shops for breast exams and talked about mammograms, and had little trucks outside where the beauty shops were so that people would just step outside and get them while they're there. We trained beauticians, hairdressers to help be part of the education process. We also did that with barbershops. We'd have trained barbers to to do tests for hypertension, to talk about the risk, to talk about their own success stories with this. And we got huge improvements in people doing the preventative measures they should, more women getting mammograms, more women understanding about breast health and what are the other factors that can increase your risk and how they could deal with those other factors. Same with men with hypertension. Again, that is a really very, very interesting community-based way to have a leverage point, to do prevention, to deal with the other comorbidities that feed into this disease that is preventable or treatable, and make sure that that happens where the people have the highest risk and the worst outcomes. And again, it wasn't us providing, it's how do we engage with the community? How can the community deliver these systems better than we can? Another thing you need to think about is what other interventions have worked, what haven't. So is it enough just to have like a doctor? No, because there was a level of trust. So, we have to look at and do our research and see what does or doesn't work. We also have to see what populations pay attention to what resources people have. Again, it requires us to be not smarter, but us to be embedded in the knowledge that we bring so that we literally are technical assistants and we can literally partner with people where they're at so that they can come up with and implement, with our help, solutions that address their community's health. We want to make sure that systems have a coordination, right? That collects data, that does evaluation so that we're not putting money where we're not getting the great outcomes. We really, really want to make sure that there's health in all things and that there's preventive health in all things, and we want to tackle the big things first. But we also want to help because part of all of this is helping people to be responsible for their health and responsible for their community's health. Because if we have healthier communities, we'll have healthier people. And the healthier people we have, the better the world will be, the more productive the world will be, and the less people will be burdened by diseases that we can do something about.